Go.
Hello, my name is Dr. Hunt, and today I would like to talk to you about passive range of motion exercises. Passive range of motion exercises are a physical therapy tool that your veterinarian may be recommending from time to time for certain orthopedic diseases or for physical therapy after certain orthopedic procedures, surgical procedures. There are two purposes for which you might be doing passive range of motion exercises. The first reason for which they are recommended is to increase the range of motion of a particular joint. The range of motion of a joint is the range from full extension to full flexion of a joint of interest. The second reason you may be recommended to do these exercises is to maintain that range of motion in a joint that may have been surgically altered. To execute the passive range of motion exercises effectively, there are two principles that I feel are essential to understand. The first principle is to understand that passive range of motion exercises are passive. Your pet is the passive member in this procedure, and you will be the motor between deflection and extension of the joint of interest. The second principle to understand is that these are range of motion exercises. As already stated, the range of motion is from full extension to full flexion of a particular joint. Today, we'll be talking about the stifle joint, or the knee joint. The knee happens to be the joint that is most commonly affected in orthopedic disease in veterinary medicine today. As such, it is the joint that will be recommended to do passive range of motion exercises the most. I recommend that you put your dog on their side when you're doing these exercises. It may be beneficial to have an assistant to help you to keep your dog interested and calm throughout the procedure. With one hand, you can place and grab the distal femur just above the patella, which is this prominence here. With the second hand, you can grab their ankle, such that you can go through extension and flexion at the same time. In a normal knee, a dog has a range of motion from full extension, which is about 180 degrees, or a straight line, to full flexion, which is approximately 40 degrees, such that the ankle touches the back of the gluteus. As you go through extension and flexion exercises, you may experience that in your pet, somewhere in that process, you will find pain. When you see a painful point, I recommend that you hold that just under the threshold of the pain for a few seconds before continuing with your flexion and extension exercises. As you do these repetitions, you may find that the pain subsides and that your range of motion increases. Extension and flexion exercises may be recommended 20 to 30 repetitions, 3 to 4 times a day, depending on the surgical procedure that has been performed or the orthopedic disease that you're dealing with. I hope today's instrumental video has been effective in helping you understand the principles and how to effectively carry out passive range of motion exercises for the knee. Thank you for your time.